24,000 doses of the COVID-19 vaccine arrived on the island of Saint Lucia on April 7th via the COVAX Facility. What is COVAX and how is it related to COVID-19 and vaccinations? COVAX is the COVID-19 Vaccines Global Access, a global initiative aimed at equitable access to COVID-19 vaccines. COVAX forms part of the Access to COVID-19 Tools, ACT Accelerator. This is a framework for global collaboration that came to fruition in response to a call from G20 leaders at the start of the pandemic in 2020. The management of the COVAX facility falls under 3 partner agencies, which include Gavi, the Vaccine Alliance, the Coalition for Epidemic Preparedness Innovations, CEPI, and the WHO, with UNICEF as key implementing partner. The vaccine cargo was met on arrival by the Prime Minister of Saint Lucia, the Honourable Alan A. Chastanet, Minister of Health, the Honourable Mary Isaac, along with her team, and PAHO country representative, Reynold Hewitt. At the official ceremony, the Prime Minister says there is no doubt that the world is in crisis and cited the arrival of the vaccines via the COVAX facility as a step in the right direction.
COVAX came out of humanitarian understanding that when we have these kinds of crises where there is going to be global demand on a very small number of products, that sadly human nature takes over and persons are intent on putting each of their countries first. And COVAX understands that we all live in a village. You can protect yourself, but if you do not take care of your neighbors, ultimately it's going to come back and haunt you. I think many of the developed countries, the G7 countries, have now begun to understand how important the developing world was to their own economies. The closure of borders and the number of persons who've lost jobs because the travel industry collapsed.
He acknowledged the sacrifices made and says he's seeing the global success taking place.
I cannot even begin to thank PAHO, WHO, and the team at COVAX for what they have done. And I can say to all of us in procurement, as well as in the Ministry of Finance, simply getting PPEs in March, ventilators, was difficult. And when I heard Governor Cuomo literally saying that the state of New York was being outbidded on PPEs and on ventilators, I remember remarking to myself, boy, we are in for a rough ride. So COVAX could not happen at a better time.
The Minister of Health, Mary Isaac, commended her team on all levels for the hard work done thus far.
I know that regionally and internationally, Saint Lucia is regarded, our healthcare workers, the Ministry of Health, is held in very high regard. And I am here this morning to encourage you not to lose faith when these things happen, to encourage you to continue the fight, to continue to save the lives of our people in Saint Lucia.
The PAHO country representative, Reynold Hewitt, underscored the receipt of the COVAX vaccines as one for the history books.
The arrival of COVAX vaccine in our region and today in St. Lucia is a historic milestone, as well as a combination of months of negotiations and commitment to global solidarity.
Under the COVAX facility, the Pan American Health Organization, along with the World Health Organization, Gavi, CEPI, and UNICEF, have set a target for the Americas to provide enough vaccines to cover around 100 million people by the end of 2021. Once this is achieved, it means that these countries will have enough vaccines to immunize 20% of their populations. PAHO Director Dr. Carissa Etienne says, because of the global limitations on manufacturing vaccines, it has been difficult for our region to gain access to the vaccines we need to immunize our populations. Vaccine production for approved COVID-19 vaccines needs to increase worldwide because none of us will be safe until all are safe. It is simple. Do your part. Get vaccinated. Vaccines bring us closer.